Hello and welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202-838-6837, and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get the next show. And with that, I'd like to welcome Anne Shoup, the Senior Advisor for Strategic Planning and Projects at Protect Our Care. And she's here to talk to us about the Affordable Care Act's birthday.
Yeah, thanks for having me, Laura. It's every year, it's good to look back and see how far we've come on this law, and this was a big one, 15. So, it's unfortunately, as has always been the case with the ACA, we are, fighting attacks and making it so, the Republicans are continue to attack this. It's always been such a polarizing law. It's always been something that we've just been on the defense on, and right now is no different. So as much as we can celebrate the success and how far we've come, and that more people are covered than ever thanks to the ACA, we're still, rather than focusing our efforts and moving forward and making sure everyone has the coverage they need, we're fighting back attacks. So I think that's where we are today with the ACA.
Thanks. And I am just one of the millions of Americans that depend on the Affordable Care Act for my insurance. And in fact, a few years ago, it saved my life. So we need to make sure that the Affordable Care Act is around for the next 15 years and many years to come. So let's talk about one of the issues facing the Affordable Care Act this year, which is that the subsidies which make plans affordable for most of the people that get them, those are expiring this year. Is that right?
Yes. So, this is something that happened during the Biden administration to really make insurance more affordable for people who purchase it on their own, like you. And so it was really incredible. And it's one of the reasons that we can see that more people were covered than ever. People were able to go and shop around and see many people could get affordable plans for, as little as $10 a month. And this is quality insurance that is there for them when they need it, that covers pre-existing conditions, that helps them get their preventative care. And so it was really incredible. And so this is something that happened during the Biden administration. And now what we're seeing is that the Republicans are trying to take this away, and they're trying to take away these tax credits. And it's really at an unfortunate time. We're at a time when no one can afford their healthcare costs to increase. And so, it's really imperative that we fight back, that we tell the Republican members of Congress who are trying to take this away from people that this is really necessary, that people need to continue to have these tax credits so they can get affordable coverage through the marketplaces.
So what happens if the tax credits, which expire at the end of this year, expire and are not replaced? If Congress doesn't act, what happens to most of the people who pay for health insurance next year?
Yeah, so that just means that the costs will go up for about 24 million Americans. And again, this is taking away this at a time when it's already hard for people who are already struggling to pay these bills. And so if we take the tax credits away from working families, we will see not only their coverage go up, but a lot of people might just lose their care altogether. They will no longer be able to afford it. So costs could skyrocket by an average of $2,400 for millions of families, and then 5 million people could lose their coverage altogether. So if people have to make these tough choices of, do I need to pay rent or buy groceries or pay for the cost of my care? Unfortunately, what we see time and time again is, people put their healthcare on hold to cover these basic essentials. And and then that just leads to a whole bunch of problems, and of course, it can lead down a really bad path for people, but then they're not getting the care they need, they're not getting the preventative care they need. It costs more money in the long run, for all of us. So it's just really essential that we try to reach the full promise of the Affordable Care Act by really striving to get people covered, rather than going backwards. And I don't know if you saw that President Obama had a really great video that he posted to his social media yesterday to commemorate the 15th anniversary. And he used an analogy that I've seen him use a few times, where he really called the ACA a starter home. The Affordable Care Act was, it was not perfect, and it was kind of meant to be a building block, and it did so much for people. It saved lives, like it did for you. It helped people get the coverage they need. But it wasn't perfect. It was something that we needed to build on to make it better. And so that was really what he was calling for, is for us to take the next steps to really try to ensure that this law can be built on to get everybody the coverage that they need. And really see the full promise of the ACA. And that's the type of thing that these tax credits that's what it was meant to do, with a whole bunch of other things that, were done by the Biden administration. That's what got us to a higher level of coverage. And so, but now we're unfortunately going backwards, and at a time when the Republicans in Congress are also, looking to attack Medicaid, which I'm sure you're going to talk about, but it's, and so there's not that backstop either of, if people can't afford their coverage, and if anything were to happen to them, if we're also cutting the safety net that is Medicaid, then people won't have anywhere to go.
Exactly. And I think your point is so important that Social Security and Medicare and Medicaid, as we know it today, are not how they were originally written decades ago. That these programs have grown and been improved upon, and the Affordable Care Act, the same, it has grown and been improved upon. It's not exactly how it was written 15 years ago, and that's because time has allowed us to improve it, and we need to keep improving it to get to the day when everybody has the healthcare they need. So your other point about attacks on Medicaid, we've talked on this show a few times about the House budget blueprint that they passed a few weeks ago that has nearly $1 trillion in cuts that would come probably from Medicaid. And so how does this affect the Affordable Care Act? Are people even aware that they have Medicaid through the Affordable Care Act?
Yeah, so I think that people don't quite realize Medicaid, like you said, it really has changed over time too, and it is more popular than I think maybe it's ever been. It's always kind of been the punching bag of those three that you mentioned, so Social Security, Medicare, Medicaid, and I think Republicans have this sense that they can use Medicaid to be their piggy bank, that they can just, go in and gut Medicaid so that they can pay for tax cuts for billionaires. And so that's what we're seeing them try to do right now. But there has already been a ton of pushback, and there's been some really interesting pushback by, I think, some more moderate members of the House. So we'll see where that goes moving forward. But I think that this is the time to really stand up there and say hey, we really need Medicaid. It's a really important program. I think people don't, since one of the reasons it's probably so popular is because of the Affordable Care Act, because it really expanded who was able to benefit from Medicaid, with the Medicaid expansion that states took up, thanks to the ACA. Now, of course, we know, because if everybody remembers, because the Supreme Court decided that states didn't have to expand Medicaid, so that benefit is not in every state. And in fact, those states are where those tax credits that we were talking about are really important. But Medicaid covers a lot of people, including people who are working, and working class folks who don't have health care through their employer. A lot of those people are covered through Medicaid. And so if there's any, massive cuts to Medicaid, then we will see that impact this expansion population. And in fact, some states even do have trigger laws, like Virginia, where if something were happening to funding, it would happen automatically. So, we are going to see Republicans are trying to claim that these cuts aren't going to hurt people on Medicaid, but there's just really no way that that's true. It's a huge number. It's going to hurt people. It's going to mean a loss in coverage. And Medicaid has been such an important lifeline to people, to rural communities. It covers a lot of seniors in nursing homes. And, it covers children and new moms and veterans and people with disabilities. So I think as this debate goes on, we'll really see who benefits from Medicaid, and I think more people will understand what this program means to even people in their own lives that maybe they weren't aware. But I think thanks to the ACA is one of the reasons that people understand the importance of Medicaid.
Indeed. Majority of people in nursing homes and care facilities benefit from Medicaid, and so I believe majority of births also. So many more people are on Medicaid than the idea that some folks have that this doesn't affect many people, or it only affects the people over there. Medicaid affects everyone. And more people are on Medicaid than are on Medicare right now in America. So we need to be aware that whether or not you personally are on Medicaid, you might be on Medicaid and not know it because it's called something else in your state, like Badger Care in Wisconsin. But everyone will be affected if Medicaid is cut one way or another. It will hurt hospitals. It will hurt the medical facilities in your state. Even if you don't directly have Medicaid, it cuts the money out of the system that keeps healthcare in your state going. So these threats affect all of us, and we are running out of time for at least the first thing that we talked about, which is the subsidies for the Affordable Care Act. That for Congress to act, they need to do it real soon, because states are already planning their insurance rates for the coming year. So there will be a time at which it's too late to fix this problem.
Yeah, we're already getting to the point where for Congress to act, it has to pass a bill through both the House and the Senate and get it signed. Like, that seems impossible. I think the easiest path forward might be to attach it to something else, where we're running out of things that we could get these tax credits attached to. This isn't a priority for Republicans, so we're really going to have to fight and get this out there. But it's the time is really running out, and so even if a fix came later down the line, that means that it will be too late for this year. Like you said, rates are already being determined. That's be coming up in the next few months. So we can't wait until this expires, in the fall to act. And this would mean raising rates for people. And raising their premium. So that will go ahead and happen in the fall, and people, might not come in. It might come in and not realize what happened, and then they're coming in and seeing these high rates, and it'll be some sticker shock, and they'll have to make some tough choices. So the time to act is really now on these tax credits.
Mm-hmm. And if you see a big jump in your health insurance premium for next year, this is why, because Congress failed to act. So you should contact your congressperson and tell them to extend the Affordable Care Act subsidies. And also people should be contacting their representatives about Medicaid cuts, right?
Yes, for sure. And, Medicaid cuts we will probably see as part of the reconciliation package. And so even though the budget blueprint went through on the House side that had this massive cut to that could only, the only way you can really pay for it is through Medicaid. There's still time there to make sure that Republicans in Congress know that this is a program we care about, and kind of hands off our Medicaid. Do not cut these essential programs, and definitely let people in your life know, because there is so much happening right now. I mean, even if you're just trying to follow what's happening on healthcare with NIH cuts and CDC and measles and these tax credits and Medicaid, it's so much. So just letting people in your life know, like, hey, this is happening, and the tax credits and cuts to Medicaid are coming, and they might really impact you. And again, like Laura was saying, that people might not realize that Badger Care, I know in California it's called Medi-Cal, so people like really might understand it as a program with a different name. So just really letting everybody in your life know, like, hey, these cuts are coming, and we have to make a lot of noise about it. And it's also going to be the Trump administration is, no surprise, making it harder to sign up for the ACA, sign up in the marketplace, with getting rid of the defunding Navigator program, and shortening the time period for when you can enroll in coverage, and just kind of doing a bunch of things that the Biden administration, kind of reversing everything that they had done to make it easier to make us have all this record-breaking numbers of amazing record-breaking numbers for more people covered than ever. So just kind of letting people know that we're gonna have to do some of that effort in the advocacy community to make up for it, to get people the care that they need this year.
Well, thank you very much for joining us, Anne, and happy birthday to the Affordable Care Act.
Yeah. Thanks so much for having me, Laura.
And now I'm going to Diane Archer from Just Care and Social Security Works to talk about some news that's happened from the Trump administration on healthcare in the past few weeks. Welcome, Diane.
Thank you, Laura, and thanks, and great hearing from you, Anne. There is a glimmer of hope, because Dr. Oz, in his confirmation hearings before the Senate Finance Committee, was very clear that he was aware of the massive overpayments in Medicare Advantage, and that he made a statement that there was a new sheriff in town with him, and that he was going to address those overpayments. And addressing them is extraordinarily important, because actually Republicans do have a choice. Republicans obviously do not have to be cutting taxes, but that's their number one priority. They want to reduce taxes to millionaires and billionaires, and then they want to have to pay for them. And they can look to Medicaid, but as you guys have discussed, that will lead to millions of people being uninsured or underinsured. And there are more than 70 million people on Medicaid who depend on it. And as you said, Laura, Medicaid is really a health insurance program that benefits the country, because we all have friends and relatives who rely on it. But they can also, and they should choose to, look to Medicare Advantage, because the Republicans have said that they want to reduce waste, fraud, and abuse. And it has been documented over and over and over again that there is $1 trillion in waste in Medicare Advantage over the next 10 years. The Congressional Budget Office documented it. The Medicare Payment Advisory Commission recently said that there was $84 billion in overpayments this year alone. Last year, there was $83 billion. The Committee on a Responsible Federal Budget has also documented it's more than $1 trillion over the next 10 years. We're talking really big numbers. So there is a choice the Republicans can make, and the choice should be that they eliminate the waste in Medicare Advantage, put Medicare Advantage on a level playing field with traditional Medicare, pay them the same amount, just don't overpay them by $1 trillion over the next 10 years. And that will save healthcare coverage for the millions of people on Medicaid, and will do no harm to people in Medicare Advantage, because this is just money that the health insurers in Medicare Advantage are pocketing. So yay to Dr. Oz for saying that he wants to go after that. That's where the Republicans should be focused.
Thank you, Diane. And next, I'm bringing Louise Norris from healthinsurance.org to talk about the marketplace changes to enrollment that have been proposed. Louise.
Yes, thank you so much for having me, Laura. So the Trump administration has put out a very wide-ranging proposal with all sorts of changes that they want to make to marketplace eligibility and enrollment. In a lot of cases, undoing things that were put in place by the Biden administration. They have called for a shorter open enrollment period, and they want that to apply nationwide. The way it works now is open enrollment runs from November 1st to January 15th in most states, but state-run marketplaces can extend it past that. They're calling for every state to be November 1st to December 15th, which would mean after December 15th, you would not get an opportunity to make another change to your plan. So people would really need to pay close attention to notifications they get from their carrier and the marketplace before open enrollment and during open enrollment. They've also proposed to completely eliminate the low-income special enrollment period, which is currently available if you are eligible for a marketplace subsidy and your income is no more than 150% of the poverty level. You can enroll anytime you want in almost every state. And they've proposed to eliminate that opportunity to enroll, so that would not be a year-round enrollment opportunity anymore for that. They've also proposed changing how auto renewals work for folks who have zero premium plans. So if you don't pay any premium at all because your premium tax credit covers the whole thing, they would, and you auto renew, meaning you don't go back in and look at your plan during open enrollment and redo your verification. They would make it so that you pay at least $5 a month until you go back in and re-verify your information. And $5 a month doesn't sound like much, but the problem is when you go from zero to any amount of money, you will have some people lose coverage just because it falls through the cracks and they don't realize they have to pay to keep their coverage. And going back to what Anne was talking about, if Congress doesn't extend the subsidy enhancements that are currently in place, there will still be premium tax credits next year, but they'll be smaller for everyone. So there'll be fewer people who qualify for zero premium plans just because those tax credits will get smaller. They've also proposed to make the maximum out of pocket higher for next year than it would otherwise have been. The rule that the Biden administration had put out, the final numbers they had put out, was a maximum out of pocket next year of $10,150 for a single person. This new rule is proposing to increase that to $10,600. So just in addition to making it harder to enroll, shorter enrollment periods, the actual out-of-pocket costs that people will pay would go up. And also eliminating eligibility for DACA recipients nationwide. Currently, they're blocked in a lot of states, but allowed to enroll in other states. They want to take that away. They've also proposed to make it so that people have to provide a lot more documentation and verification of eligibility to enroll during a special enrollment period, proving your income, stuff like that. So people just need to be heads up that they may need to provide more documentation that they haven't been providing in the last few years. The other thing is there is a public comment period open on this proposal through April 11th. So you have until April 11th. You can go on the Federal Register website. This is a proposed rule on there. It's very easy. You just type in the comment section and make your comment on there, and then they take public comments into consideration before they finalize the rule.
Thank you, Louise. Our next question is about Medicare Advantage open enrollment, because the Medicare Advantage open enrollment period ends March 31st, which is next week. So what do people need to do right now if they want to change their Medicare Advantage plans or take advantage of the Medicare Advantage open enrollment? Diane?
Great. Excellent question. People have one more week to look carefully at their Medicare Advantage plan if they are enrolled in a Medicare Advantage plan. And they should do that because lots of things change and people often aren't aware of these changes from one year to the next. Your out-of-pocket costs may have gone up. The specialists and specialty hospitals in your network may have changed. For sure, you cannot rely on being able to see particular doctors in Medicare Advantage or go to particular hospitals. You can't rely on being able to get care outside of your community, and you can't expect to get speedy care. So as a result, the Office of the Inspector General has found widespread and persistent delays and denials of care and coverage for lots of people in Medicare Advantage, and that's a concern. So if you want to get care quickly, you should know and look at switching to traditional Medicare. You have one more week to do so. In traditional Medicare, you're covered for care from almost any physician and hospital anywhere in the country without having to go through prior authorization hoops. In Medicare Advantage, if you're diagnosed with a costly and complex condition, you are likely to face delays and denials that could be life-threatening. So really consider what you might get in terms of comprehensive coverage if you switch out of Medicare Advantage to traditional Medicare. You'll be able to see the doctors you want to see, go to the hospitals you want to go to. If you're visiting a friend or a family member outside of your area, you'll have coverage. And there won't be an insurance company second-guessing your treating physician's opinions and overruling them, which a lot of people do face in Medicare Advantage. And again, in Medicare Advantage, life is pretty good until you get really sick. And that's where people often find that they can't get the care they need when they need it. In traditional Medicare, you are covered for your care that your treating physician and you want to have in almost every instance. So you have one more week. Look carefully at whether you want to stay in Medicare Advantage, switch to another Medicare Advantage plan, or move into traditional Medicare. You can do any of those things. If you do opt for traditional Medicare and you have Medicaid, you will have no worries whatsoever. Your care will be covered. If you don't have Medicaid and you're switching, you're going to probably want to get supplemental coverage, which fills gaps in traditional Medicare. In some cases, you may not be able to get that coverage. So if you are thinking of switching to traditional Medicare, call your state health insurance program and find out about your rights to Medicare supplemental insurance. Without that supplemental insurance, there is no out-of-pocket cap in traditional Medicare. So you could be on the line for lots of money if you ended up getting very sick. But you would also be sure to get the care you need from the doctors and hospitals you want to use.
Thanks, Diane. And I just want to echo what you said in that if you are considering switching from Medicare Advantage to traditional Medicare, make sure you investigate whether you're able to get a Medicare supplemental policy, a Medigap policy, because also, like you said, there is no out-of-pocket maximum without it. So make sure to do your investigations, talk to your state's SHIP. They are there to help you figure this out, and you have about a week to figure it out. So thanks for answering folks' questions. And thank you, everybody, for joining us today. Please text or call in your questions at 202-838-6837 for future episodes. Join us next week for more on healthcare in America and your questions answered. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.